Hi ophthalmologists, welcome back to MedicamTube. Today, I'll be discussing something quite unusual but crucial: worms in the human eye, their causes, and the removal process. First, if you're new here, don't forget to like, share, subscribe, and hit the bell icon for instant updates. Make sure you watch the complete video to get all the information. Check the description for more details and reading material. Let's dive in. Worms in the human eye are typically caused by parasitic infections. Although rare, these infections can lead to serious consequences if not treated promptly. Early diagnosis and appropriate treatment are essential to prevent permanent vision damage. The most common parasites that can infect the eye include Loa loa, also known as the African eye worm, Onchocerca volvulus, responsible for river blindness, Toxocara canis and Toxocara cati, which cause toxocariasis, Dirophilaria immitis, commonly known as dog heartworm. A clinical examination is the first step, involving a visual examination using a slit lamp microscope to identify the presence of worms. Look for symptoms like redness, pain, visual disturbances, and visible movement of the worm. Imaging techniques such as ultrasound or MRI might be required to detect the presence and location of the worms within the eye or surrounding tissues. Blood tests can also be useful. Eosinophilia, or high levels of eosinophils in the blood, can indicate a parasitic infection. Serological tests help detect specific antibodies against the parasites. For medications, antiparasitic drugs like ivermectin, albendazole, or diethylcarbamazine may be used to kill the worms or reduce their activity. Anti-inflammatory drugs, such as steroids, can be prescribed to reduce inflammation caused by the dying worms. In cases where the worm is visible and accessible, as with Loa loa, surgical extraction is often performed. This usually involves removing the worm from under the conjunctiva or the anterior chamber of the eye. For other parasites causing significant damage or symptoms, surgical intervention may be needed to remove the worm or relieve pressure. Laser therapy can also be used in some cases, particularly with ocular larva migrans, to destroy the worm inside the eye. To prevent these infections, avoid traveling to endemic areas if possible. Use insect repellent, wear protective clothing, and use mosquito nets. Maintain good hygiene by washing hands regularly, handling food properly, and avoiding contact with animal feces. Regular deworming of pets can also reduce the risk of Toxocara infection. That wraps up today's topic on worms in the human eye. Thank you for tuning in to MedicamTube, a great source of medical knowledge. Please leave your thoughts in the comments below. Stay informed, stay safe. See you next time. Yeah.